So ultimately, here it is. The bottom line is that the debate normally focuses down or comes into evidence. Is there evidence? Is there such a thing as subluxation? Is there evidence of subluxation? Is there evidence that people who get adjusted have health benefits, et cetera, et cetera, et cetera? The answer is overwhelmingly yes, but before you answer the question, you have to ask the question, what will you accept as evidence? We have to have the same agreement on what evidence is, and if they end 100% of the time when I ask that question, it's always randomized controlled clinical trials. And I'll say, okay, well, let me ask you some questions. Do you think that surgery is scientifically validated? And then you can just kind of go down the list there. And of course, now they're in a position either saying, well, surgery is not validated either. Okay, well then why should chiropractors have a more burdensome standard for what they do than surgeons? Which is more risky? Bottom line is this. We as chiropractors should not accept a more burdensome standard for what we do than medical doctors or surgeons. Drugs and surgery are so much more risky to the patient than chiropractic. Chiropractic is very safe. So for people to come and contend that we have to have a higher burden or a higher standard of evidence for what we do than traditional medicine, there's no rational argument for that. They should have more safety and efficacy evidence than we should because what they're doing is much riskier. People die as a result of medications. People die as a result of surgeries. And I'm not saying that medication is never necessary. I'm not saying that surgery is never necessary. I'm just saying that those are high-risk procedures, and you can't try to contend in a rational way that what we do as chiropractors, which is demonstrated to be extraordinarily safe, that what we do requires a higher standard of proof or evidence than things that are much more risky.